Hi everyone, it's Dr. Derek here. Today I'd like to discuss a really interesting case of a 6-year-old boy called David who moved to the UK from West Africa. Now, like a lot of kids his age, he kept on getting so many different viral chest infections and coughs. Now, a lot of his coughs were put down to just simple viral infections. Little did his parents know that the cause of these repeated infections was something a lot more serious. Things continued to worsen with his infections. He then started missing a lot of school, so his teachers were really worried. His parents were also really concerned because he was a lot smaller and underweight when you compared him to all of his peers. As time passed, David's symptoms got worse. Another chest infection occurred and his parents were really concerned. They took him to the GP, who diagnosed him with a viral chest infection. Later on that night, he was rushed to the emergency department. He was unable to speak in full sentences because of his breathing, and he had a raging fever. The doctors were so worried about him, so they gave him some antibiotics through a drip and took some urgent blood tests. Now, despite having these antibiotics through the drip, his symptoms got worse. He then started developing some severe chest pains. He became so restless, had some numbness and tingling in his arms and his legs. He was screaming down the whole emergency department because of how much pain he was in. The doctors and everyone around were so confused as to why such a young child would be clutching their chest in so much pain. The whites of his eyes went really pale and he needed some oxygen as well as some strong pain relief. Emergency blood tests were arranged, including a blood culture to look for an infection in the blood. He also had a chest x-ray, but surprisingly the blood culture came back clear and the chest x-ray didn't show any signs of a pneumonia as the cause of his chest pain. As part of the blood test that the emergency department arranged was a full blood count, and this blood test revealed significant blood loss. David had nearly less than half of the amount of red blood cells someone his age should have. But this was a confusing thing. Why did David have such a low blood volume? The emergency doctors went back to the drawing board and fully examined David for any signs of blood loss, but there were none. So the challenge here is to figure out what's the cause of David's really bad chest pain and this low blood count. And the time was ticking on because he was in so much pain. So the next steps involved an urgent referral to the hematology team. So they closely reviewed David's case and 3 important clues came about. Firstly, it was his repeated chronic chest infections over the years. Secondly, we knew that David was a recent immigrant from a West African country, which increases the likelihood of certain genetic conditions. And lastly, this was the clues found in his blood count, which had nearly halved compared to the blood count expected for other kids his age. So the hematologist actually looked down the microscope at his blood test, and what they found completely revealed the cause of David's symptoms, because down the microscope they found out that the red blood cells were a sickle or a banana shape and not the round and smooth shape that you'd expect to have. So have you got any thoughts on what could be causing his symptoms? The cause of David's symptoms was determined to be due to sickle cell disease. Now, sickle cell is a common genetic condition, particularly amongst the Afro-Caribbean population. Sickle cell affects the shape of our red blood cells, which are usually round and smooth, but in this condition they become a sickle or a banana shape. Now, this occurs due to a genetic issue, and when the red blood cells are this shape, that makes it harder for them to navigate through our blood vessels. Therefore, they can get stuck and cause so many different symptoms and so many different issues. Now, the main issue in this condition is what we call a sickle cell pain crisis. So this was what happened in David's situation. Now, specifically in David's situation, he had what we call a chest pain crisis. Now, a sickle cell chest pain crisis occurs when the sickle or abnormally shaped red blood cells block up the flow of blood and oxygen to the chest and the lungs. And this is what causes a lot of the pain and symptoms they have. Patients with sickle cell are also more susceptible to repeated infections like we see in the case of David, and also their growth may be restricted. Now, sometimes regular blood transfusions may be needed if symptoms progress and the body starts showing signs of damage caused by sickle cell disease, an example being anemia, as we've seen in the case of David. Now, while this condition is common in the Afro-Caribbean population, unfortunately it's not publicized so much. That's why I created this video, so that you have a really clear picture of how sickle cell disease can present. Now, make sure that you check out one of our previous videos which goes into a lot more detail about this condition. As always, if you've enjoyed the video today, please leave a like and subscribe. And remember, I truly care about your health, and I wish you the very best.